For outsiders, it seems impossible to believe that doctors, nurses, and other healthcare professionals incur hundreds of thousands of sharps injuries at work every year and don't do anything about it. Most of them don't even report the injuries that could actually maim or kill them. Most think it's their fault, either self-blame or blameworthy behaviour, and as a result of this, the staff at risk are not actively looking for ways to protect themselves, or their friends or colleagues. Many even resist others' attempts to help them. To quote a famous old professor, "But why is this so?" Researchers have identified a number of factors falling into two headings: clinical and management. Do any of these apply to you? A couple of well-reasoned solutions are also presented at the end. Like with doctors, nurses' identity takes some understanding. Not many workers would put their lives at risk to save the life of one of their customers. But when a doctor or a nurse takes that risk, they somehow become a better person. Their identity increases in value. This thinking is very paternal. A mother would do the same thing without thinking to protect her child. But as this cartoon suggests, most of the time there is time to protect yourself as well. Most staff reporting a sharps injury say things like, "It was my fault, I was rushing," or "It was my fault, I wasn't concentrating." They somehow believe they will never have another injury because they will never be busy or distracted again. This blameworthy behaviour stops the injured staff member looking for a realistic plan or safety device to protect them from injury in the future. It is well known that young men both believe and act as if they are immortal. For example, despite knowing the risks and serious consequences of a car accident, they continue to drive too fast, and often while intoxicated, because car accidents happen to someone else, not to them. Just like this, doctors and nurses kid themselves that the sharps injuries and the HIV and hepatitis infections will happen to someone else. What if that someone else is your best friend? We often paint management as the bad guy. This is not only untrue in most cases, it also allows us to abolish our own core responsibilities. That is, to stand up for ourselves and our own safety. Management, like clinical staff, focus on patient safety. When they look at a clinical situation, they only see the patient. The nurse almost disappears. I guess from their point of view, they expect staff to tell them if they're having a problem. Because most staff injury data is not a KPI for the hospital, the true cost is unknown. Because up to 2/3 of staff don't report their injuries, even when some effort to measure the cost is made, it is always grossly underestimated. If the cost of injury is unknown, management cannot know how much money to invest in injury prevention. As usual, the solutions are pretty obvious when one takes the time to look. Education followed by action reaps benefits. This works for patient safety and to stop people smoking, etc. Done right, it will also work for staff safety. Education will be much more effective when it is combined with audit. The superior effectiveness of audit in changing clinical practice has been well established by evidence-based medicine. We know what to do, we just need to do it. Are you willing to be the staff safety champion at your hospital? To support the Safety Score audit, go to www.staffandpatientsafety.org. The Quality Improvement Circle for Patient Safety is also relevant for staff safety. Identify the problem, implement an intervention, and measure the outcome.